All right. So welcome everybody to episode 14, our mental health discussion with Dr. Jonathan Bilal Abdullah. I am excited to have him here on board. I've known Dr. Jonathan for now 30 years. Can you believe it? Almost 30, not 30, sorry, since 2007. We've been in financial services for 30 years. So I'm excited to have him. And we're going to go walk through his journey because we both were in financial services and we've both taken a different pivot. He's a clinical psychologist. So I'm going to have him kind of walk us through his journey, tell us a little bit about himself, and we'll dive into some questions. And then we are also, for those of you watching this episode, live streaming it on TikTok. So we're going to field some questions from our folks in the chat. But before we do that, Dr. Jonathan, thank you for joining us. Dr. Liam O'Mara, thank you for joining us as well. We're excited to have you. Such an important topic, I think, regardless of the timing. So Dr. Jonathan, let people know what your journey was all about. You know, can you walk us through where were you and why clinical psychotherapy? Go for it.
Absolutely. First, Jamal and Dr. Liam, thank you for having me as a guest on your great podcast. I'm really excited about this opportunity to talk about a topic that is near and dear to my life purpose. So as you mentioned, Jamal, you and I go back many years now. I had the privilege of working side by side with you as a colleague in the financial service industry, which was a wonderful experience to cultivate a friendship with you in the time that we had together and up to this point. And I would just start by saying a background and how I got into the field of clinical psychotherapy was a journey. It was a journey that was aligned with my life purpose, which is to help others learn and enhance their wellness. And with the work that I had done in the financial service industry for 29 years, I had the opportunity to do that as a leader. And from the very beginning, working with associates and professionals and helping them balance and integrate their ability to deal with the stress that comes with the intensity of the work. And so through my last probably 10 years in the banking industry, I was really involved in working in the capacity of developing and training some of the top executives across the nation for a large commercial bank, designing a program that was focused on small business efficacy and learning and abilities, which included concepts like emotional intelligence, mindfulness. And I was really excited about that journey of also earning my 4th out of 5 post-secondary education degrees, my doctorate in adult education and human resource development. In doing so, I also was able to earn an award for my program, which allowed me to really get great visibility in the organization I was working at. And as I was going through that process, I recognized that the learning part of my career was just phenomenal, but there was something missing. And I recognized that when I start looking at some of the data around the field of psychology, which has always been part of my background, that the representation of people who are seeking psychotherapy for help with their problems across diverse populations was really low in many different diverse segments. And furthermore, representation was low. About 5 to 6% of psychotherapists or psychologists happen to be Black, Indigenous people of color. And even when they are people of color or of other diverse populations, the gender slant is more women than men. And so I found like, wow, this is an opportunity for me to really step into a space where I can add great value towards my life purpose of helping others learn and enhance their wellness. And I can tell you that it has been a joyful journey continuation for me now practicing as a licensed clinical psychotherapist.
It's interesting, Dr. Jonathan, that there are some parallels in your prior career as it relates to emotional intelligence, helping people overcome adverse situations, whether it's conflict within the work group. And quite frankly, we've dealt with conflict with individuals outside the workplace. And you mentioned a couple of things around marginalized communities and access to mental health benefits. I would imagine in financial services, there's some parallels there. And then you talked about women also being more engrossed in addressing mental health issues versus men. So I appreciate you highlighting that for us. Such an important topic. And I culturally, from where I come from, I believe both men and women struggle with disclosing their mental health issues because it's such a taboo. So great recap for us. So if I were a novice to you and and I said, hey, what kind of therapy do you specialize in? Specifically, if you were to break it down in 3 bullet points for me so I can fully understand it, what would you say?
Yeah. So I often get that question when I have a new patient or client seeking therapy. So the way I would frame it is that I like to use the analogy of a pizza. And so the crust of how I go about operating as a psychotherapist is mindfulness-based stress reduction, which is also known as MBSR, which is a function of mindfulness that was really developed by Dr. John Kabat-Zinn, who really started his research and work helping cancer patients deal with their issues of healing and dealing with the thoughts and the stress that impacted their healing journey. So mindfulness-based stress reduction comes with both formal and informal ways of care and treatment. First and foremost, from a formal standpoint, it's really about the practice of meditation, which is really a connection with your own sensory and your mind-body connection. And the other informal functions of it are integrating practices into your daily life that are really based upon awareness, acceptance, and non-judgment of self, having a beginner's mind and being curious about possibilities. So that's the base of my pizza crust. The toppings, I would say, from 2 to 3 bullet points of describing it, is I integrate with that somatic experiences psychotherapy, which gets into the full body, right? So making sure that we get away from this notion that our heads are dragging our bodies around all day, right? We're so top-sided. We're thinking, we're stressed here, but we're not checking into the full human system, which is made up of 11 systems. When you think about it, it's pretty complex. So I work with the somatic piece of it, and that really is helpful to me with my trauma patients that have suffered with trauma or persistent depression or anxiety. And then the third piece of it would be the cultural sensitivity. And when I look at intersectionality, that people show up as themselves and I meet them at their location. So how they've been experiencing life is unique to them, whether it's gender, sexuality, racial, ethnic background, status, national status, or even how they've gone about acculturating to different communities that they're in that may be very different or divergent from what they're experiencing from their childhood to adulthood. So I really focus on that and really putting my clients and my patients in a safe place to heal, learn, and grow.
Okay, that's I took a lot away from that. And Liam, I'd love for you to interject when you have an opportunity if there's something you'd like to ask.
Yeah, there's something I was going to ask. Yeah, or whether bring up here, but Oppo's making some noise, so hopefully he doesn't scream again right now. He just was. That you bring up both mindfulness and emotional intelligence, and I'm just reminded of my my own kind of like amateur reading in this and the kind of things that I've enjoyed. And I have read Kabat-Zinn on anxiety reduction there, as well as like Goldman and Epstein on like emotional intelligence and mindfulness. And in all of them, one of the things that really strikes me about it is the degree to which they integrate the psychological dimensions of Buddhist practice without telling people y'all got to go be Buddhist or something. Yeah. It's trying to take the core psychological insights and apply them within a broader like Western psychological and philosophical framework so that people can relate to them and understand how can this benefit me? How can this help me out? And I know I have found a lot of value in that over the years in terms of trying to center myself or address issues, because I came at things a lot originally from more of a philosophical and background, and then found these psychological disciplines. Oh, hey, I like the interplay there. Do you have people asking questions about the background of mindfulness or about Kabat-Zinn's work, or having any kind of problems with that?
Dr. Liam, that's an excellent question. Great follow-up. Yes, I do. And it's important to acknowledge that Kabat-Zinn's work is secular in nature, even though the roots of it is Buddhist in nature, which is very collectivism, versus Westernization is more individualistic. So it allows one to acknowledge that you don't have to take on a spiritual religious function of mindfulness. It's really open to anyone, right? And that's the beauty of it. As you described it, it's very integrative in nature. So really understanding that the most pure definition of mindfulness is paying attention in the moment without judgment of self, as if your life counted on it, right? Really being here. And that's one of the points that I think you highlight when you describe how you have been able to look at both mindfulness, emotional intelligence, those quadrants of self-awareness, right? Self-regulation, social awareness, and relationship management. How you connect with yourself first, and then how you connect with others is really powerful. And there's a concept that really calls that out, which is the connection curve in mindfulness, which allows us to see there's a curve, if you will, right? So on one end of the curve, we have this very high tethering and transactional nature that can be very impulsive and instinctive, versus this higher level of the curve, which is untethered and very transformational in nature, which puts less stress on our ability to operate in our own systems within our own window of tolerance, right, from our own central nervous system, and also to connect with others. So you're right, that does come up a lot. And I also honor those who are Buddhist and practice, because that's beautiful and that comes with people and their experience of therapy. But mindfulness-based stress reduction is very secular in nature. It is not rooted in a religious or spiritual containment.
Great, thank you. Thanks, Liam, for that question. And just as a reminder, those that are watching us on the live stream, please put your questions in the chat. We will leave time at the end for questions for Dr. Jonathan. One of the things that stood out to me, and I think really resonated, was where you meet people at their place, right? You talked about intersectionality. I think that's just an important call out for individuals, because oftentimes people struggle getting the therapy because they're unsure of the situation. It's unpredictable. It's unknown to them. So I appreciate you calling that out. My next question for you is, I just touted a little bit about misconceptions of therapy, right? What are other common misconceptions that people might have about therapy, and how can we overcome them as a group or as a society?
Yeah, that's an important point that I'm glad we're talking about this, because it's one of the biggest barriers to seeing the kind of successful experiences that are possible with having a psychotherapy experience. And the journey is, like I like to call it, the journey. And so the common that I hear most often is, how quick can you fix me, or how quick can you fix my kid? Right. So when I've worked with children, and I do have a few patients that are minors that I work with them and their parents, that's one of the hazards, the moral hazards of bringing someone or bringing yourself to therapy thinking, I'm broken, I'm flawed, I'm defective, and I need someone else to fix me so that I can be aligned with what society expects of me, or what my family system expects of me, or my community expects of me. And that is a common flaw that comes with that, a mental block, I would say. Also, the stigma is the other big one, is that if I raise my hand and say, I'm really struggling with something and I think I need to go see someone, that is not always well received depending on the community or the family, right? Because there's been great resources that are adjunctive to therapy, or that are primary, centered in families or belief systems, like seeing your imam, your rabbi, or your pastor, or your reverend in your church, or seeing someone as a senior elder in your community. You have an indigenous community, you have people who are well respected for their wisdom and their ability to counsel. And counsel is different than psychotherapy. It's very effective, but it's very different than psychotherapy. Psychotherapy, we go really deep, we move slow, and we're very intensive about taking care of the full system and understanding how the brain functions. So the stigma of therapy to fix me because I'm broken and I'm a bad person, or I have too many problems in my life, or, therapy is not for people like me. Therapy is for people who are crazy. And if I admit to the fact that I'm struggling with something, that's a sign of weakness that I don't want to reveal or self-disclose to the people who are dependent upon me, who respect me. And what does that mean for me to go to therapy? Does that mean that I haven't been strong enough? I haven't taken advantage of the capabilities that I possess, or opportunities? It's a self-judgment block that gets in the way, and misconceptions. And then the last one I would say is this idea that you walk into a therapeutic setting, and you're lying down on the couch, and you're closing your eyes, and the therapist is this wise wizard, right? That is an all-knowing and is going to tell you all these wonderful things and ask you these questions and just nod and say, right? And have this very stoic approach to treating you. And then you walk out the room and some magic has happened in that moment that has transformed your life. That's not the case at all. So I like to make sure that I'm clear when I do a free consultation with a new patient or client to help them gain more psychoeducation, is what we call it, to be more informed about what is therapy, what does it really mean, and how can that look for me, whether it's in the room with the actual therapist or psychotherapist, or if it's even through telehealth, through a computer technology like we're using now. And I do that as well.
Yeah, a lot of great call outs. And the one that stood out to me, and I think society in general, especially the younger generation, if you will, and no knock on them, that instant gratification. Like we have to have the instant results, whether it's in this space or other spaces, and we have to be realistic of the process. And quite frankly, we have to trust the process, that ultimately the result takes, the effective results take time. It's interesting you said in various groups, specifically in indigenous communities, and I would even say the same for our community as well, that you go to the elderly for guidance because of life's experiences. And the reality is everyone's experiences are different. And so what they may have experienced along the way is not going to be a remedy for you. So I appreciate you calling that out. Among the other things you said, a sign of weakness as well, right? We all feel like one of the reasons we don't get engaged in therapy, well, maybe that's considered weak in my culture. And we have to overcome that, because I think that's strength versus weakness, vulnerability, which is a strength. So I appreciate you calling that out. Liam, before I get into the next question, would you like to add anything else?
Well, yeah, there's actually a couple different things I thought about in terms of the question of its effectiveness and people's going into it. But yeah, I also appreciated the question about strength versus weakness. I was actually thankful that my mother was kind of an early adopter in this. She ran a child care center, and she had at least some experience or training there. So when she and my father went through a very messy divorce, tons of lawsuits and all kinds of stuff there, she put both of her sons into therapy as very small children, trying to get us talking about that kind of stuff. And I think it really helped. But a lot of people, especially back, because this is beginning of the 1980s, back then really looked down on this, and it's still very problematic. Although I'm very thankful that the tide is shifting on that, and it's becoming more and more understood as healthcare. And so on that topic, there was a book I read a few years ago, Rethinking Psychology by Brian Hughes, about whether or not psychology is a science or not a science or a pseudoscience, because there's a lot of pseudoscience that masquerades as psychology, including a lot of those like some of the self-help type stuff, or like the personality type stuff that's really not based on anything rigorous, but there's a lot that really is. So I think there's an interesting clash of perceptions as far as whether or not psychology as a whole, the profession or psychotherapy or the different techniques, like the DBT, things like that, are based in science, or if they're just based in somebody like, I don't know, going back to the origins of psychotherapy and like Freud basically just like analyzing himself and, coming up with stuff. How do you respond to people who might wonder whether or not this is evidence-based, whether or not this is empirical, or it's just something it's all up in your feels and somebody's making it up?
Yeah, that's an important point too. So, and I welcome that curiosity, because I think it helps people come closer to understanding the power of psychotherapy and psychology as a study and a field and a science. That much of what we do and what I do, so I'll speak specifically for myself, because I think there's different variations of interventions and therapeutic approaches that have less evidence-based versus those that are more conceptual and more dynamic in their approach. But I'll start with just first the brain. What we do know now, because of the advancement of our technology and our understanding of science, that the brain itself is an organ that functions with processing of stimuli and experiences that we can see from CAT scans and MRIs. We can see the matter of the brain, and we can actually look at the physical brain's response to those different things, right? So we know that. And when we know about the fact that the autonomic nervous system, part of the central nervous system of the brain, which is the main operating system, that it splits into two. It splits into the sympathetic nervous system and the parasympathetic nervous system, which we like to refer to as the fight, flight, freeze on the sympathetic and the rest, digest on the parasympathetic. And what we do know from science and research is that when we work with people on identifying, particularly the sympathetic nervous system, what we like to refer to as the window of tolerance, when someone is experiencing hyperarousal, which is flight or fight, or hypoarousal, which is freeze, that there is a physical change to all the other systems. We can see it in the circulatory, the respiratory. We can see it in the integumentary system, the skin, the hair, everything around the body. We can see it even in the reproductive system, right? So we see the connection of the science. And there's a full ocean of body of research that shows why the brain being treated with the kind of care that it deserves from a human connection of experiences, emotions, interactivity, that there is proof and evidence that when we do things to help people make themselves more aware of how they're taking in information and experiences and self-regulation of that it impacts the rest of the body as a whole system in a way that is favorable and sustainable. So that science now is a lot stronger than maybe it was in 1980, to your point, right? You know, some people are like, oh, you're just getting your head shrunk and I can talk to you. I'm smart. You know, what is a therapist or a psychologist or a psychiatrist going to do to help you? And we also know that, of course, there's medications that can complement the psychotherapy process. The psychotherapy is well grounded and now vested in evidence that we can prove it out and people can actually see the experience happen for themselves.
Yeah, there's a couple things on that too. Well, actually, okay, so one that occurs to me on that, and the question of medications, one thing that I would like to invite you to push back on is a common misperception that many people have, some of them coming out of some religious frameworks or maybe culty ones like Scientology, that have a real problem with any kind of psychiatric medications. And it does seem that it's still, many of them will work very differently on different people. So there's a real question of like comorbidities and whatnot, and how different things complicate things, variations in genetics, all kinds of stuff there. I do have another question on effectiveness related to that, but that's partly personal, partly like broader. But on the question of medications themselves, how do you address anybody who comes in saying, well, I'm very skeptical of that. I don't think that I need a drug for this. I think maybe I can just talk it through and maybe talk it through with you or my family or whatever, but I don't need a drug to fix this problem. How would you put somebody more at ease that there is a scientific basis behind these different medications and the ways that they affect, like, serotonin uptake and everything else?
Yeah. And I do have people come in with that. And the fact that I stay in my scope of practice is that I do not prescribe any medications, because that's really relegated to psychiatrists or practicing medical doctors or primary care providers who have that ability to prescribe medications. But I do partner with psychiatrists and medical doctors who do prescribe patients that I work with, and we partner together that the therapeutic interventions I employ, along with medications to treat symptoms, is effective in some cases, not all cases. So I do not advocate for medication as a starter. I'm more inclined to defer to, let's work with what you got here in your system. Let me meet you at your location. Again, I know I've made reference to that earlier, is that let's see how we can use some of the things that are sensory based, right? That can help you adapt to some of the symptoms that you're dealing with. Even as something as simple as these beads, right? That represent cool awareness or protection growth, that our five senses are there to help us connect with natural elements. So there's things like progressive muscle relaxation, which is a somatic experience exercise that is proven to help trauma patients deal with trauma loops and trauma defenses. So it also helps with depression. It also helps with anxiety, instead of maybe taking Zoloft, which is a common prescribed medication to help deal with some symptoms. So I'm not a proponent or an advocate or I would say resistant to people having medications prescribed by their medical doctor or their psychiatrist. I do find that sometimes they have nasty side effects that could be hampering to people's progress, or become very codependent upon those medications. And sometimes they can be disruptive to other systems, right? The body has 11 systems. It's a very complex system. And so doctors have to monitor that with blood panels and checkups and interventions. So I would say that just be prudent about advocating for oneself when you're seeing your medical provider, when you're looking at medications being prescribed, asking more questions about what are the potential side effects? How might this impact my other systems? What are some other natural or psychotherapeutic alternatives that I can try first before you prescribe me a medication? So that way, no one feels like they're forced into that experience of the only way to help you is by being prescribed a medication that might come with some nasty side effects.
Yeah, and I have a perfect follow-up just from there that I think may help some of our listeners who are considering therapy and or have had difficult experiences with it, because I know I have, and I think some of that. Okay, so just thinking specifically about your expertise in terms of treatment, sure. Right? So let's set aside for a second the question of medications and all that, the science, the side effects, everything around that, and go back to the working with what we have that you're bringing into there. A lot of people do come in with multiple complications into something, where we're all like, you go through a lifetime, you take in all kinds of things, you have different starting points. So to make it kind of personal, that would make this easier. I'm autistic, ADHD, savant, and have PTSD. So trying to treat the issues that have come up there, the anxiety that results from the PTSD, realizing some of the things that I thought were just like a kind of simple generalized anxiety or actually related to a much deeper issue. But going through different types of talk therapy, I've struggled to find something that actually treats it well either. And some of the complications there, I think, come from I'm neurospicy to begin with. And I think a lot of people have had similar experiences. And I've heard of things like that where they've had difficulty with either medications or with therapy or both because there are multiple complications. So given that you've mentioned that you treat anxiety, depression, and trauma and whatnot, how do you deal with that in terms of the intake for people that do have different issues? How do you figure out what would be the best approach for them that takes into account like the full picture?
Dr. Liam, I love that question, and I'm so excited that you asked it because it gets me excited to be able to speak to it. So you using your own experience, so thank you for sharing that and being self-disclosed. That you're talking about the comorbidity of several things going on, right? So neurodivergency, which tends to create some resistance in how you function because people want you to mask or they want you to align, right? So you got that factor. ADHD, which is really a defense of your brain and how it likes to deal with stimulation, right? So it's like short intervals, if I can move from short intervals to short intervals, that feels easier in many cases for someone who's dealing with ADHD. And then the fact that you said you've also experienced trauma, right? Post-traumatic stress disorder, or, having that is really big because trauma is contained in you. And trauma can create two bullies. I like to refer to them as bullies: shame and guilt. Why am I broken and flawed? What did I do to deserve this? And I should feel guilty and responsible for it because that's easier for me to make meaning of it because it was far beyond my ability to deal with in the moment or the experiences of trauma. So I'm constantly in this push and pull kind of momentum. So what I would say is that, let's just say if you were one of my patients, we would start with working on a collaborative treatment plan, right? So it's not that we just say, oh, I'm going to slap somatic on you. I'm going to slap CBT on you. I'm going to slap DBT on you, because all of those have different functions and abilities, but it goes back to my analogy of the pizza crust, is that the first thing we want to do is make sure that we have a great depth of awareness, a mindful awareness of what does your system do, right? How does your system respond to certain stimuli? Where do we need to help you start to build some mindful boundaries? There's 6 domains of boundaries: communication, time, physical, mental, relationship, emotional, right? So where we create those boundaries start to help you learn some integrative practices, not moving fast, but progressively building those and integrating those into your life in a way that feels empowering and that works for you, and practice it in session, right? So you and I really holding space together, and we practice that. Now, one other point I'll make to that, this is a mindfulness concept that I use with both patients and with clients that are couples. It's referred to as sitting beside you with empathy. So what it means is that if I were to hold up both of my hands right now, where both of you can see them, you could tell me what you can see. You can see the lines on my hands. You can see the pigmentation on the light side of my hands. But what you can't see on the side that I'm sitting on is the dark brown skin, the fingernails, and the scar I got when I was 11 years old, right? So when you're sitting across from me, you're only seeing that. But when you're sitting beside me, you're experiencing with me. So how we would develop that treatment plan is that I would be practicing sitting beside you empathetically, so that we're going into real experiences, the phenomenological experiences for you that, wow, what is that like, Dr. Liam, to have to walk into a room and then try to mask neurodivergency because you're getting a visceral response from some people, or you're not being included in a way that feels safe for you. And what does your system do when you feel unsafe? And how do we regulate, and how do we create more insulation for you so that you're not contorting yourself to fit someone else's system? You're being present fully as yourself and allowing that to be a safe space for yourself. How does that land?
Yeah, it makes a lot of sense to start off with some of the mindfulness stuff and the body awareness, being aware of your different responses. And I can just tell you from my experience, especially coming at this as an autistic person, it can be very difficult to sort out what it is I'm actually feeling, how to put it into comprehensible terms for somebody. And being aware simply of my own body's responses, my own thinking about something, what I'm feeling in the moment. In hindsight, I can always go back. So I'm like, ex post facto, I'm fine. I can sort through it. Okay, I was feeling this. I was feeling it. But in the moment, I frequently struggle with that. And I have had a hard time trying on my own to really master some of those kind of techniques to really center that awareness. And I think that's some of the part of the basis, at least, for my wondering how best to figure out the therapeutic approach. You know, like what's the order of things? How do you address somebody? Because if somebody's really struggling to identify things, and I found this in work with a therapist, I laid out that problem right at the beginning. I often have no idea what I'm experiencing in the moment. It only makes sense later. And she really struggled to come up with a way for me to be able to do that. So I think it's interesting to consider just how hard it might be to find the right approach to lay down that pizza crust, as you're saying, in a way that starts from the right first step in order to get to where you need to go. Sometimes people are jumping over and using the particular techniques or training that they have there without first laying down that crust of basic awareness. And then I like that you mentioned it's more like collaborative, that like there's a dialectical aspect in terms of figuring out what would work best for somebody. Because I think not every therapist is going to do that as effectively. So that's another one that might be a useful caution for people who are walking into this and have had difficulties with the therapist. If you've gone to somebody before, don't think that it's always a problem. You know, everybody is a little different. Everyone brings in different training, different experiences, and somebody else may be able to help find you that first important step on which you can build those layers.
Yeah, and it's a phenomenal point you bring up, because what I like to refer to as slowing down recognizing that the breath matches the thought. You know, when we breathe in through our nose 4 seconds, we hold for 2 seconds, and we breathe out of our mouth like we're blowing out of a straw. That's like the reset of the brain, the system to say, okay, am I here or am I dealing with time travel? So I like to refer to anxiety as that. Anxiety is the brain saying, I'm going to the future of some imminent threat or perceived problem that's coming up. So I got to get there now. I can't be present. And depression is always often a face on the same coin that causes the brain to go in the past. Oh, I lost something. I'm sad about something that's happened to me. And I can't move beyond that moment. I'm still there. I'm still hurting. And so really, to your point, Dr. Liam, is you're absolutely right. And I'm glad you called it out, is that I try to caution many patients that I see for the first time. They've been to 3, 4 therapists, and they're saying, oh, I had a good therapist that was okay, or a bad therapist, or a therapist that really know what they were doing. Well, I respect my colleagues and my peers in the profession. So I often highlight that, no, it's about finding the right therapist for you. Because even across all the interventions that can have efficacy of treatment and care, 70%, and this is proven for research, 70% of therapeutic effectiveness is based upon the therapeutic alliance between the person you're seeing. Do you connect with them? And I do that my first session. I say, look, whether it's a couple or an individual, I tell them on the front end, before we're done with this session today, I'm giving you a platform to say, Dr. Jonathan, you're not my jam. I don't rock with you. We don't vibe. Or, oh, yeah, this feels safe for me. I feel like I can work with you, so that they're not feeling pressure, because therapy should not add stress to your healing journey. It should be empowering. It should be rejuvenating. It should be healing and learning and growing. So it's really about finding the right match. And I encourage all your listeners that follow the great work that you both are doing to take note of that don't give up on yourself. Just make sure you find the right match for you.
Yeah. I love that. And there's a few things I want to recap, because you highlighted a number of points that we all need to be reminded of. And for those of you listening on TikTok, please put your questions in the chat, because we're going to have some time. But I wanted to highlight a couple things. The initial point you made, which I think is so important, is in terms of medication, and coming from a place of curiosity and asking, is that really the appropriate route for me as a patient? Do I have to take medication, or are there other ways to treat what I'm experiencing? And Liam, I have to thank you for being vulnerable and sharing what some of the things that you've experienced throughout your life. The other thing I wanted to share is the relationship aspect of it, right? You have the right to say, this isn't working for me. I need to find someone that aligns with what I'm looking for, so that I'm effectively treated and there's some longevity in the treatment. I appreciate you highlighting that. And the last thing I want to say, and I think we all experience this, Dr. Jonathan and Dr. Liam, is we're all shackled by the past. We tend to be shackled by the past, and there are various ways to overcome that. But again, it takes time. It's a process. You can't assume that it's just going to happen overnight. And whether it's me, Dr. Liam, you, Dr. Jonathan, we're all shackled by the past at one point or another in our careers or our lives, and we have to work on ways to overcome that. You know, I wanted to ask you a question, because timing, like, when do I start therapy? Like, for our folks listening, how do I know it's the right time to engage in conversations around some of the mental health concerns that I have? When do I know it's the right time, Dr. Jonathan?
Yeah, and that's the biggest step of all the therapeutic journeys, just getting started and knowing when to seek out someone. And I'll give you kind of the clinical, but also the kind of kitchen table answer to that. The clinical answer is that when someone is experiencing stress or mental discomfort or dysfunction to the point that it's impairment to their life. So it could be school, for someone who may not be an adult yet, a minor or adolescent. It could be for an adult, school and or work. It could be relationships, right? It could be the family system, when the family is having such dysfunction and impairment to connect in a way that is healthy. That's a strong indication that therapy is likely a really great way to resolve some of those issues, like you talked about, shackled by the past, right, that have been there for some time accumulating, or deal with present and imminent concerns that are impeding someone's ability to be able to live a life that is healthier. And it doesn't always show up in just a mental thought or beliefs or stress in the way that we like traditionally think about. It shows up also in the body. Dr. Basil van der Kolk talks about in his book, The Body Keeps a Score, which has been read by millions of people, and obviously everybody in this field. From a somatic standpoint, your body will start to tell you too. Your body will start to talk to you. And so when you start seeing poor sleep hygiene and change in your dietary impulses or instincts, and when I say dietary, I'm not just talking about food, right? I'm talking about how much are you consuming things that are not healthy for you, whether it be overdoing it with social media or entertainment, or it could be substances that you're self-medicating, right? I see that often where I find people are, consuming alcohol, not for social entertainment purposes, but they're consuming it just to go to bed at night, right? Or they're taking some other form of substance to try to lessen the stress that they're experiencing because they're constantly out of their window of tolerance, right? They're constantly being hijacked or stimulated or triggered, depending on if they're a trauma survivor. And those are all the indications. So for any of your listeners right now who might be listening to this now live or in the future, record it, I would urge them to check in with themselves to see, okay, am I able to have the basic human balance of I'm able to process my food healthy. I'm getting a gallon of water, ideally a day, in my system. I'm having human connection, leisure, and learning the things I need. And I'm able to live a life without always feeling like I'm on the edge, right? Like I'm white knuckling everything. Those are all signs that if you're not able to answer that with a definitive, like, yes, I'm good, then there might be an opportunity for you to seek out some mental health services and see a professional.
Yeah, some great call outs. And I know there's people popping in. Before I forget, I do want to recap some of the things that Dr. Jonathan said. You all can follow Dr. Jonathan on this platform at eMind Theory, and you can find Dr. Jonathan Bilal Abdullah on LinkedIn. You could see his name in the background here. I love that you said, obviously, hygiene, you started off with that. That was your base. But in terms of diet, consumption of social media, consumption of news, and overdose of those things. But the most important thing that resonates with me is that self-check. What are the experiences on a day-to-day basis that are causing me an overwhelming response to some of these unhealthy aspects of my life? And so I appreciate that. There's a good call out. I do want to go on to some other questions, but for those of you in the chat, if you have questions, please put them in the chat. We're going to leave time for Q&A here at the end. But Liam, did you want to add anything else or ask anything else before I moved on with Dr. Jonathan?
Not ask per se. I mean, I did like you mentioned the Body Keeps Score. I'm actually just rereading that now. There's a lot of good stuff out there. And I like that so much of this stuff is accessible to people. They can pick things up, they can read for themselves and see. And that's another thing that for anybody who is really interested in this whole process that I would personally encourage, if you have somebody you're working with and they're talking about a particular thing, and pick up a copy and work on your own. Like you mentioned, again, Kabat-Zinn at the beginning, he's got great books on mindfulness and whatnot. You can pick some of this stuff up, but don't think it's a substitute for the process with the therapist, because there's a lot that you get in terms of that back and forth that can really customize things. But it does help, I think, at least for me, I know, and from some other people I've talked to have at least some knowledge of what you're doing and how the systems work, and that there are good books that are written accessibly enough that non-specialists can read them.
Yeah. I'm glad you mentioned that, Dr. Liam, that we refer to as bibliography as a part of therapy, that different books that we may recommend or invite our patients to read so that you're more informed. The more informed you are, the more empowered you are. Yet you also called out an important point that I think you and Jamal are highlighting here, is that you cannot replace the experience of seeing a psychotherapist with a book or one, program that might be out there. There's a lot of great stuff that you can find out there, but keeping in mind that we actually go through hours and years of clinical training, and we have a responsibility to take care of you, with including informed consent and knowing that therapeutic experiences can evoke certain things that are really repressed in your subconscious that can be really hard to deal with. And if you're not sitting with someone who knows what they're doing, particularly when it comes to trauma, that can be harmful to your health. So I just want to put that out there, that reading books and learning things and watching videos and different programs that are out there, that's fantastic. I love it. More information that we can get out to people who need help, the better. But also recognizing that we're trained on things like suicide prevention. And we have reporting responsibilities for protecting, elders, dependent adults, children, people who are dealing with things that are legally putting their health at risk from a mental health standpoint, and a physical risk as well. So dealing with someone who's a licensed professional who is trained clinically in what they're doing is ideal when you start to seek out someone. And I'll just plug this in there before I give it back, is that psychologytoday.com is the main directory. So that's where you go to find out in your area. You can put your zip code or your city and say, okay, who's out there available, who's seeing patients, and if they take, my insurance, or how they go about doing therapy in person or telehealth. That's a great starting point to find somebody who's clinically trained and licensed and verified.
And Dr. Jonathan, can you give us that one more time so I can share it with the group?
Yeah. It's psychologytoday.com. It's a website.
Psychologytoday.com.
Yeah, it's the directory for all licensed practitioners. So I'm listed there like other of my peers who are licensed by their state, and each state has their licensing requirements. And so you obviously see somebody in your respective state that is licensed and credentialed and able to provide you care.
Awesome. So for those of you listening to us that will eventually catch this recording in a week, and those in the chat, it's psychologytoday.com. It's a great way for you to do your research to determine who is going to be the best for you to help you through whatever mental health concerns that you have. So again, psychologytoday.com. So appreciate that, Dr. Jonathan. My next question, then we're going to jump into some of the audience questions if there's nothing else. So you and I and Dr. Liam have worked, and many listeners have worked in an environment where it's really tough to keep a work-life balance, right? We know the number of hours we used to work in the financial services industry, and then the work we take home, and the bosses we worked for didn't make it very easy. I think you know what I'm referring to. So how do you help, or what recommendations do you have for people that, hey, it's an essential part of your day-to-day to have that work-life balance? What are some recommendations to overcome being a workaholic, if you will, and to inject some of that balance so that you're not overwhelmed and you're not stressed out and you're not feeling the anxiety of the imbalance?
Yeah, you mentioned, we all have experienced that, right? I think most of us have experienced that at some point. So I would start in terms of recommendations, Jamal, is reframing, right? So instead of the old term of work-life balance, let's talk about work-life integration. And so that's a very different conceptual place to come from, to recognize that, because technology has advanced so fast in the way in which we do work. Our social connections, our family connections have advanced so fast that we're no longer just contained in work or in our lives separately. Those things converge. So being able to recognize that time is the currency of life, how you invest and spend your time defines you. There's no escaping that. So really looking at each day to determine for yourself, okay, how am I going to deliberately, with intention, not expectations, but with intentions, go about my day to ensure that the work that I'm accountable for, I can focus and be there and be present with that work when I need to, and also be to integrate throughout my day opportunities to connect. So I'll use myself as an example. I have my own office suite and I have this home office. My wife works from home, and I know that I have things that I have to do that really needs to be focused on my work. When I'm dealing with a patient, if my phone is off, no one can talk to me. It's uninterrupted time to take care of my patients. Yet that doesn't stop me from using the power of the smartphone and FaceTiming my lovely wife and saying, hey, what's going on with you right now, right? And she giggles at me because she's like, here we go. Because I'm always checking in, how are you practicing joy today? Have you got it from your desk? Because she works at a desk. Have you got some air, or what's going on with you? Or, can I bring you an Americano when I come home? I know that's your favorite drink, making bids, love bids. So I can do that within my day, but then also I can see my next patient and still be okay. And that is really restorative for me to know that I'm not like, you're at work 9 to 5, you're shut off from your family, you're shut off from your kids, your best friend, you can't talk to them until the weekend. No, your life is an experiential journey. And by being integrative and knowing that, because we have technology, we have advancements, remembering to practice joy. Joy in a verb is defined as to experience great pleasure and delight, rejoice. Joy doesn't just tap you on the shoulder when you're on your weekends and say, oh, here we are, time for some joy. You can actively engage in practicing joy throughout your day, and that reduces the amount of stress that we put on ourselves. That would be my recommendation.
Well, I appreciate the terminology shift, work-life integration. I think that's an essential, deliberate, being deliberate in your actions. Did you say love bids? Is that what you said? BIDS?
Yeah.
Love bids. All right. You all heard it. Love bids.
Yeah.
So a love bid is calling your loved one and asking them if they've got something that's a favorite of theirs, coffee, dessert, food. You call them throughout the day. Dr. Liam, I know you're listening to this as well as I am. And so I appreciate you calling that out. That's a new one. I'm going to use that. What was your love bid for the day? That's going to be the question. Because I think we all need to work on it, quite frankly. And then joy. I read the book of Joy by the Dalai Lama and the Bishop Desmond Tutu. It's interesting that you mentioned that, because oftentimes joy stems also from doing good deeds for others, because your immune system is much stronger when you're doing good deeds for others versus doing good deeds for yourself. And studies have shown that in various universities, especially in the IE. So thank you for calling that out. So we're going to pause for a moment unless Liam wants to interject or add anything else, and take some questions from the audience. I know, Summer, you've been jotting them down. If you can come in and give us some of those questions. Again, those of you in the chat, follow Dr. Jonathan Bilal Abdullah at eMind Therapy. He's on TikTok, right? You can find him on LinkedIn. And for those of you in our podcast, this will hopefully you can do the same when you're listening to this, which will be published next Monday. So I have some questions for you. Thank you, babe. Liam, anything else before before I jump into the audience questions?
No, this has been great, and I'm looking forward to hearing what questions people want to bring into it.
Cool. So the first one I have for you, Dr. Jonathan, is what do you think of Dr. Gaber Mate and his descriptions and his understanding of trauma?
What I think of it, wow. I'm almost gushing. I love his understanding and his work on trauma. Dr. Gaber Mate really has zoomed us out to understand the magnitude of how trauma shows up. And I'll just call out one of the most specific things I think is important from his work that he's helped to highlight in the profession, is that the attachment experience from childhood has a very big factor in how trauma can start from the very beginning of the time of human development. So, and I'll make a couple of reference of context that we know from the work on attachment theory, that you have what's called a secure attachment with your primary care provider, which is the healthy attachment, whereas a child in the very beginning has a high oxytocin hormone connection with their primary care provider. They're secure, they're healthy, they're not impeded by anything that makes them feel unsafe. You have an anxious attachment in which a child feels like they're constantly in need of attaching and the risk of losing their primary care provider. And then you have the avoidant, which has now become less attached due to neglect or abuse. And you have disorganized, which is in the basic, it could be a blend of anxious and disorganized. Dr. Gaber Mate does a great job of helping us understand his own experience. He was given away as a child. It was a mercy gift to someone who took him in as his adopted parents, and he went through trauma himself. And so what I love is that he makes that very clear connection of how important it is for us to all have secure attachments preferably as children, right? So that we start out on a good footing, and how we have a sense of self, a sense of value, a sense of ability to operate and communicate, and not compromise our authenticity for the sake of always wanting attachment. What he also has done really great in his work is helping us see that trauma is more prevalent than what has been reported, right? So we have all this data on depression and anxiety being the most prevalent disorders, mental disorders. But in fact, I would tell you that 80% of my patients that I see, and some of the individuals and the couples that I see, are trauma survivors. And they don't realize it until they sit in my office and we go through and I help them gain some sense of definition. So I love his work. I think if anybody wants to read his work or watch some of the videos on him, I highly advise it if you're trying to go through a process of discerning, have you experienced trauma and been undiagnosed and uncovered and treated? And not that we need to just label you, because labeling doesn't help, but having meaning of, like, there's not something significantly specially wrong with me. It's what happened to me, right? Replacing why what would happen.
Awesome. Thank you. And thank you for those that are asked the questions.
Great
Next question. And again, Liam, anytime you feel like jumping in, what emerging somatic therapy modalities do you think have the most promise for helping traumatized patients get back into their regular bodies, get back into their bodies?
Ooh, these are great questions. You got a great guest. It really depends, right? Because I would be ambitious to say I have like the perfect package of somatic experience exercises that would help everyone. So what I would start with is saying that one that I have found, I think I mentioned this earlier, is a progressive muscle relaxation technique for trauma when someone's dealing with oversensory, like they feel their body, they can't get control of their body when they're being triggered or being activated from trauma. That has helped me with patients that I know who have been survivors of sexual assault and sexual abuse, as well as other forms of trauma, because oftentimes when we are dealing with trauma in our bodies in a way that we get activated and triggered and we feel like we don't have a sense of control, that can be really devastating to our ability to function day to day. So I would say that's just a basic core one. There's others, many others. And then I'll put a plug in for one that I'm pretty partial to because I'm a ketamine assisted psychotherapist. So ketamine is a legal and safe medication treatment now that can be dosed and be integrated with therapy. And what I have found in the work that I've been doing with ketamine assisted psychotherapy, what it does to the brain, it blocks the NMDA receptors, which are the ones that go to the memory that causes the trauma looping. It gives a freedom from that for a period of time, and it excites the AMDP receptors that allows you to feel free, right? So it's a freeing moment. So you're seeing more psychedelics come to play. So as Dr. Liam was asking earlier about medications, psychedelics are becoming a great alternative to a lot of patients who are saying, I don't want to be on drugs, taking them every day, but I do want to do something that's going to create a different neuroplasticity of my brain, to rewire my brain, to also get out of my body and then come back into my body, somatic with treatment as an integration to help me move forward in my journey with traumatic healing.
Awesome. Thank you. Thank you, Dr. Jonathan. I've got a few more questions, but Liam, anything else you want to interject before I move on?
This is I don't know. How does that go? Right. I want to ask a question that's kind of personal, and I was trying to think of a cute way to frame that other people are asking. You mentioned both the ketamine and the psychedelics and whatnot. I've heard, I've actually read a few articles on how promising this is, and then there's what's the Change Your Mind by Pollan on psychedelic treatments there, and I've been curious about it for trauma for a while and seen that it does have a lot of promising uses there, but I've honestly never thought about it seriously because I'm neurospicy in 3 different ways on top of that. So how does someone determine? So if you're already doing ketamine assisted and you're more familiar with the psychedelics research, how would one determine if that's even appropriate to use, or whether or not somebody's existing wiring could be harmed instead of helped by it?
Yeah, excellent question. So how we would do that, first, I partner with Journey Clinical, is the organization I partner with as a licensed provider of ketamine-assisted psychotherapy. So let's say if you were my patient, we would first start with you having a clinical consultation. And that clinical prescriber, medical doctor, or nurse practitioner would sit and talk with you to go over where you're at in terms of anything that you've experienced in the past, any kind of medications you're on, your medical health, because not everybody's eligible, right? So it's not like, and that's why I'm always careful when I get questions like, hey, what's the one way, what's the silver bullet to this werewolf? Like, there is no silver bullet, right? So you would have to first go through a medical, and it could be your primary care provider who could do that too, right? So you go through that medical process to make sure that it's a safe and prudent way for you to go about your own psychotherapeutic journey. After that process, that toll gate is met, then you and I would sit down and go through a preparation session to talk about what is your intention? What is your specific intention with having ketamine-assisted psychotherapy? What is it that you're looking forward to working on as part of an overall comprehensive health program that is therapeutic? That's what that would look like in terms of determining the fit.
Awesome. Thanks. Thanks, Dr. Jonathan.
Thank you very much.
Yeah. So, Liam, anything else? And guys, keep for those of you in the chat, if you have additional questions, put them in the chat. We are live streaming Office Hours with JNL. It'll be published next Monday, but we know that how important this topic is, so we are live streaming it on TikTok. So again, Office Hours with JNL. So my next question for you, Dr. Jonathan, and there's a couple more. Education on health industry structure is severely lacking in the U.S. What are ways, or how can we improve this? Some thoughts on that?
So education for just the public, the population of people who are trying to learn about mental health?
I believe education on the health industry structure is severely lacking in the U.S. Yeah, let's start there. Yeah.
So first, we've got to mainstream and deal with the parity issue. That if the basic way for me to explain is that if one of the three of us had a broken bone in our body and we had a cast on it, everyone who saw us would attend to us in a way that was caring, empathetic, and be sensitive to maybe our immobility to walk, if it was a leg or arm, immobility from opening a door, that we're a lot more conscientious about physical health and physical impairment than we are about mental health. So we've got some work to do to make sure that when people have invisible disabilities, if they're dealing with something severe, schizophrenia or bipolar disorder type 1 or type 2, or other neurodivergencies that are not well received and accepted in the main population, that makes people feel marginalized or excluded, right? That we start to highlight the importance of informing the general population of what that means to demonstrate kindness, compassion, acceptance, and awareness. That's just the basics, right? So that's what I would say is the basics. And then start integrating mental health early on in the educational system, right? Put it right on the same lane with that, so that the time that children reach kindergartner and they start to go into first grade, allowing them to understand that emotions are okay. We've got this really bad rep about emotions, that there's good emotions and bad emotions. I happen to be a grandfather now, so I have a toddler running around, and she's got all these emotions and sensory. She's sensory motory. So when she gets sad or angry, we allow her to experience those emotions because they're healthy for her to experience emotions, versus, well, children should be quiet and they shouldn't be upset. They shouldn't cry. No, nothing can be further than the truth. To think about helping children learn early on how to develop an emotional intelligence, that I have emotions and I also have learned ways to regulate myself and take care of myself, or to seek resources when I can't take care of myself. That would help us prevent a lot of suicide ideation that happens to a lot of kids who get into middle school and high school, who get bullied 24/7, and then they have the risk of suicide plan to action, right? So, you know, we've got numbers like 988 now, which I'm happy about, that instead of having just 911, if a teenager is experiencing suicide ideation, they can chat or they can call someone to talk to privately and say, I don't know if I want to be here anymore. And someone can be trained on the other end of that phone or that text to say, you matter. you're valuable, you're hurting, and it's okay to hurt. It's okay not to feel okay sometimes. That's where we have to start. And I think we build from there, from this the population. And the last point I'll put to that is making sure that when we're doing health visits for people's annual reviews, that our medical practitioners are also saying, hey, when's the last time that you've had some concerns about your thoughts, your feelings, that you have attended to yourself, or when's the last time you've considered seeing a psychotherapist or a psychology expert to help you if you need, right? So we're partnering better, and that companies don't just give benefits to you get your physical every year, but also giving you benefits and incentives to see someone for your mental wellness as well.
I love that. The integration of those discussions, not just exclusive, but they're inclusive. Thank you, Dr. Jonathan. It's important. I think the other piece that really stood out is recognize, you talked about the impact we have when people have physical injuries and how we engage them in a conversation. And that needs to be paralleled when it's mental health concerns that deal with emotions. Such an important, and we're all learning from it. I mean, look, I said earlier, this is not something that just automatically gets a fix overnight, right? Because we're in an environment that wants instant gratification, you have to trust the process and know that this journey takes time, and just stick with it. I have a question for you around books. What are the best books on boundaries? For you, Dr. Jonathan, or even Dr. Liam? I know, Dr. Liam, you read a lot of books, but what are some books on boundaries that you would recommend? And I don't know if that's a clarifying question. It's a clear question. So whoever asked that question, if it's not, let me know. Dr. Jonathan, is that clear on boundaries, or is that? Do you want me?
Yeah, I think the question is clear. Nothing's coming to mind for me right away as books on boundaries that I've read that have like comprehensive on that topic to say, here's how you set boundaries. What I can offer as one approach is that, use Google Scholar, which is an underutilized gem. If you go to Google and you put in the search Google and then Scholar, it gives you a new search engine. And then that is really looking at peer-reviewed journals and books that have really been tested, right, by people in the field. And I would say start there and looking at and maybe previewing some books. You can search even by book and put that keyword boundaries, setting boundaries or maintaining boundaries. That would be a great place to go, because none of us are the Wizard of Oz. Like I said, nobody has all the knowledge and knows all the books. So I would start there. And then for me personally, I work with my patients and my clients on practicing mindful boundaries. So I mentioned earlier, there's 6 domains, and I help my clients learn something called the 3D feedback method, which is describe your experience, define the meaning, and determine the emotional impact is a way to set boundaries. So what that might sound like is that I know that when I'm in this environment, it means the world to me to be able to walk in a room and connect with people who are comfortable saying my last name, or comfortable at least trying to say my last name, right? Not being afraid of that. And that makes me joyful, right? When even if you mess up my name, that you made the effort and you didn't just make me feel invisible in the room, right? That I matter. So that's one way of setting a boundary from a communication, that if I'm walking in as a Black, Indigenous person of color in a room that I am the minority or one of the few, and my name has an Arabic origin, and some people might go, yikes, that name, like, how do I say that, right? They're going to avoid me, or they're going to engage me and treat me as such. That's a boundary. If I don't get that kind of experience, I know that this is not a space for me. This is not a safe space for me. So now I've cultivated a new boundary for myself, but I recognize that there's some rooms that I don't want to be in because I don't feel safe. I don't feel welcome. I don't feel like my presence is valued.
Understood. Great thing. And so I see that, and I recognize what you're saying, and it is a boundary you've set for yourself in terms of, and you use the name as an example. Are there times where you need to help people overcome that, the folks that you're dealing with, maybe because those are some insecurities that they have, or they feel it's too complex, so they don't want to engage? Is that something you might consider as a therapist for in your treatment?
Absolutely.
Is that?
Yeah, I come from a place of curiosity. And so when I use that example, is that recognizing that being curious, wondering like what's going on, where's that coming from, and inviting people to have dialogue, right? To have them talk about it. And in cases where I know that that's not possible, that's where a boundary becomes. And boundary is not about always keeping people out. So I want to be clear about that, because I think that we have now the term narcissist being thrown around, or gaslighting is being thrown around. You know, they're becoming part of pop culture and not necessarily using the right context. Boundaries are not only about keeping things that may be harmful outside of your experience. Boundaries are also about containment, right? Yeah. So being that time is your currency of life, one of the boundaries is that how do you budget your time? Do you have a boundary around your use of social media when you're just, you know, doom scrolling or watching too many funny kitten videos, right? Like you could lose an hour watching funny pet stuff. I can lose an hour watching funny babies, toddlers, being a grandfather now because I love babies. So just having some boundaries about your own containment is another part of living a healthy, sustainable life.
Awesome. I appreciate you qualifying that. Last question for you. And so we see one of the results of the genocide in Palestine is people developing continuous traumatic stress disorders.
Yeah.
This is something we don't see as the U.S., or at least a disorder that they haven't treated. What do you think is the treatment for this, or recommendation? I know that's a pretty broad question, but when you think about treatment, what would you highlight or recommend?
Yeah, well, first and foremost, the genocide effect of the Palestinian people is horrible. And so my empathy and my heart goes out to those who are impacted directly, who have family there, who are seeing that tragic war, and as it's been defined, happening, which is not really a war. It's just, it's unfortunate. It's a fortunate scar in our humanity. And it is trauma, right? So when you're seeing people suffering in a way that they have suffered, many of the folks that are in that area of conflict, that they're being impacted directly, and their own sense of existence being and compromised, that kind of trauma is just as meaningful as you being there physically, because the brain is recording it. The brain is aware. So trauma being defined as that, not necessarily only the event or experience, is how it's impacting your brain. So if you're going through a lot of distress because you have family, or just because of your compassion for people, then it is ideal to see someone, right? To do some work on that, because that kind of trauma could be life impairing, limiting. And first and foremost, just making sure that you're also monitoring how much of that you're intaking, like anything, because you may be continually knocking yourself out your window of tolerance. And if you never get that rest digest system, the parasympathetic nervous system, to take a break from it, then it's causing you more harm. So I would say monitor your intake as well as a first starting point. And then if you still need help, then you seek out a mental health care provider who can support you.
Awesome. Thank you, Dr. Jonathan. Folks in the chat, thank you for the questions. Those were amazing. And before we wrap up, I'm going to give you a few reminders. But Dr. Liam, anything else you'd like to add before we give Dr. Jonathan a plug where people can find him, and just really express our gratitude for him joining today?
No, I just want to say I greatly appreciate conversations like this, and reiterate that mental health is healthcare. Don't fall for any of the social stigmas around this. You know, like it's definitely gotten better than it was, but they still exist. There are sometimes cultural boundaries, there are family boundaries. There's a lot of occasionally conservative pushback on things like this, not taking it very seriously. But it is something that I think almost everybody is going to benefit from in one way or another, because we all pick up. I mean, your mom made a point about this pretty early on, about the way our past sits with us. And there's little things that we experience all throughout our lives that are going to head us off in different directions, you know, create certain patterns, you know, repeat certain behaviors. You know, you dig little ruts in your mind, and you're just doing something that may not actually be a particularly healthy coping mechanism. And it's sometimes very difficult for us to recognize when we have an unhealthy coping mechanism. I think, Jonathan, you mentioned or maybe Jamal was like the use of alcohol or something, because that is attempting to regulate the body in some way. That is a coping mechanism. It's just not a very good one. And we sometimes treat that completely separately from what might have caused somebody to turn there in the first place. And then we stigmatize the addiction as a whole other issue, right? So you've got an underlying condition that may have encouraged you to do something, and then you have that on top of it. And all of this socially, there's still a tendency to discourage people from actually seeking treatment or taking seriously their own health care. And I appreciate conversations like this specifically because it's an opportunity to push back against that, to help people to feel more validated in their own needs and in listening to that and in taking seriously what they can do to live a better life.
Well said.
Well, we are at the end of our episode, and let me just tell you, I can't express how much we appreciate you joining us today. I think this should be an ongoing conversation. We're gonna ask you to come back. I know Liam and I will agree to having you come back, because it's one conversation just doesn't do it justice. But I'll tell you, the value that I've gained, and I hope our chat did, is just tremendous. So heartfelt gratitude to you. And it's interesting how life is a full circle, right? Like I said earlier, Dr. Jonathan and I have known each other since 2007, and here we are both pivoting from an industry that we were both in for a long time. And the value that you added today is just tremendous. So thank you. And for those of you that want to follow Dr. Jonathan on TikTok, it's at eMindTherapy. You can find him there, follow him there. And also on LinkedIn, you have his name in the background. So you can check him out on LinkedIn. And if you're wondering if this is the way Dr. Jonathan has always been, very monotone, very, very well spoken, yes. This is exactly the space he needs to be in. I remember listening to his coaching sessions, and one of the things he mentioned earlier in the discussion is that side-by-side therapy. Tell me you didn't implement that in your coaching session as a leader in financial services. And I think it's such an essential part of growth and trusting the process and evolving as an individual. So I appreciate you bringing that aspect to the conversation. Again, thank you to everybody that joined today. We appreciate you. Dr. Jonathan, again, thank you so much. Dr. Liam, everyone else, don't forget this episode will be published November 11th on YouTube, Podbean, Spotify, Apple, Amazon for audio, YouTube for visual. Thank you to our mods that were in here, Summer, Danny, Emily, appreciate you. And Danny's going to edit this video for us. We can't tell you how much we appreciate everyone that was liking, Erica, Stroop, the whole 9 yards. And we're going to invite you back, man. Like I said earlier, we want you back. And so everybody on TikTok, thank you so much for joining us today. Have a blessed day. Be good. Stay out of trouble and take care of each other. But first and foremost, you got to take care of yourself.